I'm Rick Buck and I've been a dentist for 16 years. Today we're going to discuss the steps involved in Class 2 dental composite fillings, and that means the decay extends to in between the teeth. As you can see, the decay on this tooth is on the biting surface, but on the x-ray you can see it also extends to the surface between the teeth. So let's get started. After the patient is numb, we begin the procedure with the filling preparation, which means it's the slot that we drill into the tooth. Now, I will use a high-speed dental drill to remove the decayed or damaged part of the tooth to what I think would be an optimal filling, which normally includes the enamel over the decayed grooves and surfaces. And this slot would be deep enough that a filling of that thickness won't break once it's a filling. So that's how I know the depth I'm going. Now, when I'm drilling to this extent, this may remove all or most of the decay in the process, especially for small cavities. However, at this point, you can see a ton of uncovered dental decay and it's still there. You know it's decay because it has a more brown or orange appearance than the vibrant yellow tooth structure called dentin. And dentin is the layer under the enamel and it's more yellow than the white layer, and that is healthy. The dentist will carefully shape and clean the prep, which is what we call the slot that we're drilling into the tooth, to ensure optimal bonding of the dental composite material that we're going to put in just a moment. So if drilling doesn't remove all the decay, as it doesn't here, then we remove the decay with a slow speed drill. This drill with a round burr is good at removing decayed tooth structure without moving a lot of healthy tooth structure in the process, whereas a high speed drill just removes anything it touches. Now, if you were the dentist, you would notice you're done drilling out decay because the decayed tooth comes out as this mush or flakes. In contrast, healthy tooth will come out as dust when drilled on with a slow speed drill. You can see it takes drilling on the decay a few times before the decay is removed completely. Now, after I've removed the big decay spot in the middle, you will see it looks like a healthy yellow dentin should look, unlike some of the decayed spots on the same tooth. But all along the way, I go back and forth between the slow speed and high speed drill many times. Now you get a feel for what I'm doing on this tooth, and I'm going to do the same thing on the tooth next to it, but I'm actually, for this video, not going to show much of that at all. So let's kind of skip all that, and next I will put this matrix band on the teeth. The matrix bands help to keep the tooth dry when filling the tooth, and it also helps the filling and other materials you're putting in the tooth from spilling all over, and it also creates a nice shape for the final filling. In addition to the matrix, I also insert a wedge between the teeth. A wedge helps do a couple things as well. It adapts the matrix tightly to the tooth. However, the most important aspect is it slightly wedges the teeth apart to make up for the thickness of the matrix band. If a wedge wasn't used, once you remove the matrix band after the filling was done, it would leave a tiny gap between the teeth that would get food caught in it when chewing and eating your food. But with the wedge, as you will see, I am slightly spreading the teeth apart, so when the band is off, the contact between the teeth was compensated for and is tight. Now, another good thing about the matrix band I didn't say earlier is I can also see better the healthy dentin because it's not covered in saliva, and the light reflecting off the metal helps me to visualize things just a little bit better. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. And these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. Once I feel like all the decay is removed, I use my Explorer to ensure the remaining tooth is hard as a rock. You can also hear how solid the tooth sounds when you're doing this step. With decayed tooth, it doesn't normally sound this solid. You can also see how yellow the remaining dentin is without discoloration at this point, and that likely indicates that the decay is all gone. Next, I'm going to move on to what I think might be the most important step that I do for every filling. And dentists are taught to do this on deep fillings, but I like to do it on almost every filling. I apply this liner called GC liner. It strengthens the underlying tooth with fluoride and helps a lot to avoid possible sensitivity. Then we light cure the liner and it hardens into place. And after that is in place, then we etch the surface of the dentin and enamel enamel that will strengthen the bond of the final filling. Now, this blue stuff is etchant, and the downside of etchant is that it can make the teeth a little sensitive, which is one reason why I apply the GC liner before I put on the etchant. The liner stops the etchant from causing sensitivity in vulnerable areas of the tooth prep. So once we've applied the etch, we let it sit for a few seconds and then we rinse it all out. And with the etchant now done, I move on to bonding the filling. This bond is very, very strong, and it's called peak universal bond. This bonding is what will attach the filling to the tooth. If you don't apply enough bond, the filling can be sensitive and come out easily. And to ensure that I get a good bond, I also like to scrub the bond into place, which has been shown to increase the bond strength. And once we're done with it, we kind of suction and air off the excess bond and set it with the light cure. And after the bond is in place, then we move on to the resin composite filling itself. You will see me here express the composite into the slot in the between portion of the filling preparation, and I am pressing on it tightly into place with a blue instrument. Like the wedge, this instrument also ensures a tight contact as it presses the filling into all the crevices. I then shine a curing light that will set each layer of this resin filling. After this first layer sets, I take out the blue instrument and then I add another layer until it's all complete. A great feature of white resin composite fillings is that you can add resin composite to them if it hasn't been contaminated, and this layering is essential when the filling is white resin. And the reason why these layers are essential is because the composite will shrink about 1 to 5% when we cure it with the light. If you didn't do it in layers and you filled too much at once, it would put stress on the tooth and would encourage leaking of the filling after it was done. So it is important that we continue to fill these teeth in layers to not put too much in at once. This will ensure the integrity of the filling to the tooth and avoid sensitivity. Now, the first layer happened before I put in the resin because the first layer is actually that GC liner that I put in earlier, which is another reason I do it on almost all fillings, because you have to do layers anyway. On the final layer of the resin composite now, I try and shape the filling to look like the actual tooth. Now, once the filling is set in layers, we then use a finishing burr on the high-speed handpiece to smooth out the filling and get the height of the filling just right. To do this, we will use a blue biting paper that will reveal where the teeth bite against each other. If the patient feels like biting down, things just feel off, the marks left by this paper will tell us exactly where to file down the tooth so that we can adjust it and get it to feel right. This way, the bite will feel even when the numbness wears off. In fact, a lot of why I'm doing these steps is more fully explained in my video about tooth sensitivity after fillings, where I go over all the ways dentists can prevent sensitivity when putting in a filling. Now, after we got the bite right, we also want to make sure the floss snaps in between the teeth correctly. If it snaps tightly, food likely will not get caught in there when chewing. Now, once the floss snaps well in between the teeth and it looks and feels even to the bite, we give it a polish with the slow speed drill and a specific burr for polishing, and then once it's polished, we're done, and we got a nice filling out of this that likely won't cause any sensitivity and hopefully lasts them a long time, if not a lifetime. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.